Okay, good morning, everyone. Here is Sophie speaking from the Health and Environment Alliance. I would like to welcome you to this webinar, to this introductory webinar on healthy buildings and healthier people. So before we start, I wanted to inform you that we're recording this webinar so that it can be also benefiting people who wanted to be with us today and who unfortunately could not. What I will do now is to explain you a little bit what we're going to do in the next hour. So we're basically going to walk you through how do buildings impact our health, and that will be done in collaboration. So with HEAL, you will have an introduction to the science by Vijoleta, my colleague from HEAL, and also you will have specific points from Roberta from the European Federation of Allergy and Airways Disease Patients Association. So that is one of the HEAL members. So I hope you all can see the screen now. We're going to the next slide. So just to introduce you quickly to what we're going to talk about. So the first thing, we will have an introduction on the links between buildings, climate and health, because that is not obvious for everyone. Then we'll go into more details about the scientific evidence on how buildings do impact our health. We will then go on to how to achieve climate-friendly and health-promoting buildings in the EU, and that will lead us to a discussion where you will have the opportunity to raise any question you may have. I will explain to you how Zoom works, because Zoom is a system where you can raise your hand and ask a question, and that will be explained so at the end of the presentation. So, first question is, what is HEAL and who is HEAL? So HEAL is the Health and Environment Alliance. So we are basically a network based in Brussels. So the Secretariat is based in Brussels, and we represent over 75 organizations around, 29 countries in the European region in the sense of the WHO. Our members are doctors' associations, patient groups, nurses' associations, public health institutes, research institutes, non-for-profit health insurers, women's groups, youth groups, and environmental groups. So we are bridging all these communities together, and this is what brings us to do three main things. So you can see HEAL as a kind of interpreter, a translator. What we do is translating science into policy, science into understandable language that can have an impact on policy around health. We also engage with the health sector into discussions on environmental health and as a basic prevention, basically. And the third thing that we do is highlighting the link between public health and environment. So let's go now into the details and really the hard thing. So today we're talking about buildings, because buildings are an environment, are one part of the environment we're living in. So what is the link between buildings and health? I'm sure many of you are right now sitting inside, if you're not, lucky you. But basically that's where we spend most of our time. We spend around 20 hours a day indoors. And what does that make to our health? What does it do? So when we sit inside, we are breathing, so we're exposed to indoor air pollution or air quality, that depends where we are. We are exposed to ventilation that can be inadequate. We are also exposed to moisture, to mold, to chemical contamination, because wherever you sit, whatever you touch, whatever the painting in your building is, this is all made of chemicals, and that can contaminate you. When we sit inside, of course, we're also exposed to temperature. So maybe we are exposed to thermal discomfort, maybe it's too hot, maybe it's not hot enough. we are exposed to lighting. Maybe it's poor lighting, maybe it's too much, but it's often poor when it's a problem. And another thing is exposure to noise. And there might also be other things. So the science shows us that the figures show us that actually currently 1 in 6 people in Europe live in homes that make them sick. That's actually a huge proportion. And when we think about the environment, very often we think about nature, we think about air pollution outside, but actually we should also be focusing on what's going on inside. What are the health impacts? First and foremost, what is being shown is that there is an impact on respiratory and cardiovascular diseases. So this is one thing. The other thing is that buildings can impact our mental health, and very often this is an overlooked aspect of it. And ultimately, buildings can lead to premature death. So it doesn't sound very happy what I've just presented to you now, but the good news is that actually we can do something about it. So if we work on our buildings to make them healthier, we ultimately can make ourselves also healthier. So let's go now to a bit more details on buildings and climate, because now we talked about buildings and health. The second link was buildings and climate. So you may have heard about something called the Paris Agreement, climate change. We all know there's something to be done there, very, very big challenge for the human family here. And it appears that the buildings are actually one of the key sectors that can have an impact on climate change mitigation. Why so? If you look at the figures relating to the energy consumption by buildings, you will see that actually 40% of all energy in the EU is used for buildings. It is a huge proportion. Close to the same proportion actually is also true for the CO2 emission. So actually 36% of all CO2 emissions are actually produced by buildings. And now the biggest figure we would like you to go away after this webinar is actually that 75% of EU building stock is energy inefficient. So the vast majority of buildings are not energy efficient. And obviously this can be helped. We can do something about it. So what can we do about that? There are two kinds of buildings. So there are the new buildings, but actually they are the minority of buildings, and the existing stock. And so if we want to achieve the Paris Agreement and the goals that were set down there, we need to do something about the existing and the new building stocks. So it has an impact on the urban policies of what we do in the cities. And just to put that into perspective, so in the middle of the 20th century, only 1/3 of the people were living in cities. This has changed tremendously, and actually currently more and more people live in cities, and it is expected that into about 30 years time, 70% of people will be living in cities. So what does it mean? It means that we can improve the building stocks. And if we do that, because we build them, we can control that, we can have a big impact on climate change mitigation, and also at the same time, we can have a good outcome for public health. And that has so it has a consequence sorry, on 3, let's say, communities. It has a consequence on what do policymakers do. So are they aware that there is an impact from buildings? How well are they informed about that? And what do they want to achieve at all levels of policymaking? The second thing is, what do industry know about it? What do they know about their responsibilities and also about what they can do? And ultimately, and this is where we are here today, is what does the public health community do, know, and envisage in order to make buildings healthier, in order to make people healthier. So that was a brief introduction into today's topic, and I will now give the floor to my colleague Vijoleta, who will explain to you the scientific evidence on how buildings impact our health.
Thank you very much, Sophie, for this great introduction. I'd now like to run us through some facts and figures stemming from a number of studies conducted in the past in different European countries, trying to demonstrate all the different ways in which buildings impact the health of their users, how they impact the respiratory health, as Sophie mentioned, but also cardiovascular health, the health of children in particular, but also mental health and to some degree the productivity of building users. The following examples are by no means complete, as for this webinar we are focusing on health impacts linked mostly to issues such as air quality and energy inefficient buildings, and only very little on the health impacts of, for example, chemicals in building products, for example, or other building related risks such as injuries, access to green space, crowdedness, and so on, which all matter if we want to ultimately achieve a perfectly healthy building. So first of all, looking at respiratory health, the evidence base here is good. It shows a clear connection between the exposure to indoor air pollution and both acute and chronic changes in lung function and increases in respiratory symptoms. Indoor air quality, as many of you probably already know, depends on a number of factors, including outdoor air pollution that enters as we simply open our windows to ventilate, but also it depends on the building products that are used, as well as household products that are used in the building and that are emitting a number of pollutants that impact especially those already suffering from asthma and allergies. The 2017 report estimated that living in a building where we have insufficient ventilation, so most likely bad indoor air quality, but also possibly humidity and mold, etc., the people living in those are up to 40% more likely to suffer from asthma. Children especially are a very vulnerable group. Can we just click once? Sorry. Children especially are a very vulnerable group, and they react much more strongly to these factors. And in fact, there is a great deal of evidence on children living in poor or inadequate housing, which is usually referring to homes that are either too cold or too warm, or that have mold or humidity issues. And such poor housing increases the risk of severe ill health or disability by up to 25%, according to some studies. And children that have lived over a number of years in a certain damp accommodation and conditions are over twice as likely to develop asthma or have other problems with chest, breathing, and bronchitis. Another study from 2016, for example, concluded that it's 25% of children who lived in poor conditions that then develop long-standing illnesses compared to only 15% who lived in better housing. So our homes matter from day one, and they will impact our health for the rest of our lives, which is why this focus on children in forthcoming research is very important. But as Sophie also mentioned, it's not just about respiratory health that suffers. Other indoor risks are also present and sometimes a bit less talked about. For example, high noise levels, usually associated with buildings that are potentially not shielded enough from, for example, traffic noise, but also other reasons, have been associated with higher blood pressure and even hypertension, especially in elderly patients. Blood pressure is also linked to the thermal comfort we experience in the buildings we live and work in. For example, we know that improving indoor temperature can reduce medication use and can even reduce hospital admissions, according to some studies conducted in the past years. So other risks to health that are expected here are, for example, also coming from radon, let's say, which is a gas that is often found in building basements. It's coming from the ground, which we know from plenty of evidence also has very negative health impacts, such as increases in rates of lung cancer. So there's plenty of issues besides just air quality that one can look at when we look at buildings and their impact. I already touched upon it, and I'd like to expand a little bit more on the issue of indoor temperatures and thermal comfort. Especially in residential housing, these situations can sometimes mean life or death situations, especially among senior citizens and low-income groups, as low indoor temperatures are associated with an increased risk of heart attacks, an increased risk of stroke and of respiratory illnesses. And there's plenty of evidence here that shows that countries with the poorest housing conditions demonstrate the highest excess winter mortality, meaning that we know generally that more people tend to die in winter than in summer, but we know that a large share of these excess winter deaths is actually attributable to the entirely preventable experience of living in a cold home. Many studies have been looking at this, especially in the UK. There is less evidence available for how deaths in summer in homes that are too warm, so for example, in some parts of Europe, in Southeast Europe, let's say, where homes are not insulated sufficiently against heat waves and similar, and where cooling technologies might not be available or accessible to residents, how that impacts the health of people. But we do see the evidence here increasing as well, and rightfully so, because climate change will potentially result in more hot days, in more heat waves, that the buildings that we're building in the future need to be able to shield us against. This is also, so when we talk about indoor temperatures, this is also where this need for healthy buildings meets the discussion and the issue of energy poverty, which some of you might be familiar with. In the European, in the EU, we assume that at least 50 million people are estimated to be impacted by energy poverty, which means that they are not able to keep their homes sufficiently cold in summer or sufficiently warm in cold winters. And whereas energy poverty has multiple components to it, living in substandard and energy inefficient homes, which we heard from Sophie, many homes in the EU are, is usually a major determinant, coupled with, of course, high energy costs and low incomes. But this is where these two discussions really meet. So we've seen now that buildings can impact our physical health, but they also do impact our mental health. Living in cold homes, let's say, coupled with potentially problems to heat those homes sufficiently, is associated with anxiety, it's associated with high levels of stress, and that counts for both adults and children. In a 2017 survey, it was found that about 1 in 5 adults in Great Britain say that the housing-related issue impacted their mental health negatively, and there is multiple studies that are trying to identify links to depression and other more serious conditions stemming from an environment at home or at work that does not provide the sense of safety that we expect buildings to provide. Last but not least, buildings that are either poorly ventilated or too hot or have any other negative characteristics that don't only impact our health, but they also impact our general well-being and our productivity to some degree. And there's been quite some studies who've also been looking at that, who've been looking at how the productivity of students and of employees has been inspected, and they found that especially indoor air quality makes a difference here. For example, improved ventilation increases the rates of passed exams for students. Poor indoor air quality can mean up to 9% less productive employees. Similar with noise, which can also disturb the concentration of children in schools and classrooms. And if you, for example, have very high background noise from the street coming in, studies have been showing that students are performing lower. So there is a whole set of these well-being and productivity-related arguments that are also calling for better buildings from that perspective, and that we can also use in our argumentation here. Whereas we won't be going into great detail here, there are, of course, additional risk factors stemming especially from building materials, as I touched upon briefly before. Whether we talk about flame retardants that are used in a number of building materials, but also household products and furniture, despite being linked to risks to the development of fetuses, of infants and small children, and many other health harms, or whether we talk about VOCs, those so-called volatile organic compounds, which can also cause irritations to the nose, to the eyes, but even much worse, they can actually impact kidney function, liver, and central nervous systems over time. Some studies have even linked VOCs to childhood leukemia, etc. So there is plenty of evidence out there that's linking a number of chemicals used in building and in building products to very negative and very harmful health impacts. So that means that every energy efficient or well ventilated building or home is not going to suffice if we do not address at the same time the dangers of the very buildings it's consisting of, it's made of. And I know that we have some experts on this call here today who could surely later in the discussion round maybe tell us how we can also advocate on these issues at the same time. Now, transitioning into the solutions, one can, of course, turn the story around and say, let's look at the positive side of it. How can building renovations and building improvements improve the health of residents and users? Unfortunately, the number of studies that is investigating this positive impact, and the case studies we can use here, especially in the EU, are still rather low. So there's definitely a need here for more positive case studies. However, from those that we do see a great potential of, for example, insulation improvements of existing buildings. So meaning that we want to achieve a better control of the thermal comfort inside buildings and create drier, warmer homes. We see that if done right, those can result, as some studies have shown us, in improved self-rated health. They can result in decreased days off school or work because people feel better, they get sick less, decreased visits to a general practitioner even. Some studies are looking at fewer hospital admissions for respiratory conditions, and most definitely, if done right, reduced incidences of asthma, hay fever, and other allergic reactions. I do say, though, if done right, because we know that green or well-insulated buildings are not automatically healthy buildings, precisely for the reasons I mentioned before, such as, what are the materials that are being used, what are the chemicals in those, but also what are the other requirements that actually make a building healthy. We will talk about that more in a bit. Last but not least, I'd like to say that we do also have studies that show us the financial benefit of these issues. So we know that renovations actually pay off. For example, just one study, a 2016 Eurofund study, estimated that the cost of renovations would easily be offset by reduced healthcare costs. And they even suggested that for every €3 invested, 2 would already be paid back within the first year. So the potential is there, but there is a lot to consider when advocating for healthier buildings. And so I'm giving over again to Sophie and then to Roberta, who will introduce us a bit more into what that is that we actually need to consider when we as a public health sector advocate for this issue, after knowing that it can be quite complex. Thank you.
Thank you, Vijoleta. I hope you are not freaking out right now about this picture of the situation. So this was a very comprehensive picture of how buildings can have an impact, a negative impact on our health. And now we are going to talk about how they could have a positive impact at the same time as a positive impact on climate, on climate-friendly policies. So I'm now giving the floor to Roberta, who is, as I said earlier, but some people joined in the meantime. So she's working at the European Federation of Allergy and Airways Diseases Patients Association, that is a HEAL member. And Roberta, you will explain to us now, yes, how can we do next? Just to say it also that EFA has been working a lot on healthy buildings until now, and especially in the past month. Some of you may know at the European level there was a lot of discussions about that, and also especially on indoor air quality, thanks to IFA on the energy performance and on the Energy Performance of Buildings Directive. For those who know that, the nickname is EPBD. Roberta, the floor is yours.
Thanks, Sophie, and thanks, Vijoleta. I hope you can all hear me properly. So yeah, I will basically go through the next slides on the how to achieve climate-friendly and health-promoting buildings in the European Union. These two concepts, when you think about buildings, they don't usually go hand in hand, right? But we know that changes in legislations are needed if we want to have actually buildings that are able to mitigate climate change and at the same time promote healthy for people. We need to have some of the legislative changes are needed, and we have, as the health sector, are in the right position to propose certain types of recommendations. As Sophie mentioned, we are representing patients with respiratory diseases, and we know that these people are the most vulnerable and are the first to react to the buildings where they're staying. So we know what we need, basically. The first slide will actually be on the recommendations to policymakers, both at the EU and national level. We have identified 6 there. So the first one is that they should prioritize health when they have some implementation of EU legislation at the national level, or when they actually propose new legislations at the country level. For instance, they could actually reflect the latest health evidence in the national building codes. And then, Sophie, you mentioned that last couple of months ago was actually adopted by the Council and the Parliament, the Energy Performance of Buildings Directive. Now it has to be implemented at national level. We know that there are certain provisions there mentioning health, and the fact that when thinking about energy performance buildings, we still need to consider the health impact of these buildings. But it's up to the country, it's up to the member states now to basically make it possible. So we should actually have stringent health considerations in the implementation at national level of this legislation. Then we should try to move to 100% renewable energy in buildings, design and renovation, and not to use fossil fuels as much as possible. Prioritize buildings that are used by the most vulnerable groups, such as children, elderly, patients, women, should also be one of the main priorities for policymakers. This, for instance, might mean having sensoring device monitoring indoor air quality in schools, but also an important project that I could use as a kind of best practice was the Ireland Warm and Wellbeing Pilot Scheme. So in Ireland, where actually it is possible to give grants to people with chronic respiratory diseases, children and elderly, to renovate their houses. It's a very positive project, but at the same time, we have to underline that we know that the uptake has been quite slow due to the difficult requirements and the application process. So again, it can be adopted and improved. We should regulate building materials and replace those hazardous materials as much as possible, so hazardous chemicals with safer alternatives, and have green public procurement. For the special case of indoor air quality, I'd like to mention a couple of things. We believe that it's important to have national indoor air quality helplines, as they already exist in some countries, in the Scandinavian countries, for instance. And in the case of Sweden, we even have an ombudsman for indoor air quality, so people can actually call and ask questions and also ask for solutions. And at the same time, monitoring indoor air quality as much as possible, especially, as I previously mentioned, in schools, hospitals, and those buildings that are actually used by the most vulnerable groups. Then the next slide will be on the recommendation for the industry and for the building industry. Now, the first one would be, once again, apply health criteria as much as possible. This means having improvements in ventilation, efficient provision of heating, testing radon, which was mentioned by Vijoleta as one of the most dangerous chemicals in buildings, having management of moisture and moss, and also a restriction in the use of chemicals as much as possible. We should also reduce the environmental and health impacts of materials and equipment that are used in buildings. Apply and regularly update the occupational health criteria, once again, the choice of building materials. And the last one, but certainly not least, is inform and involve building users about ventilation needs. Indeed, having ventilation guidelines is as important as having the ventilation systems itself. Sometimes we don't realize that if it's not maintained properly, this can actually be even more risky for our health. So we need to have this kind of guidelines that will help us to manage and maintain the ventilation systems in our buildings. And these guidelines need to be, of course, easily accessible by everyone, but as well as understandable, so written in a lay way, in a lay public way. And this also means that probably the end users should actually be involved in this drafting by the industry and by the building industry themselves. And one other slide on the recommendation that we have for the officials and authorities at the local level. The first one would be, we should always consider health when we do urban settings and when we do urban planning. And so this means, for instance, when we think about building schools again or hospitals, we should consider the distance between a very polluted area because of industrial presence there, but also busy roads. As I mentioned, we represent people with asthma, allergy, and COPD. It was actually shown that 15 to 30% of new asthma cases in children could be linked to the fact that these children are actually staying around a polluted street. So this is very important, and we need to underline it as much as possible. And the same happens with COPD patients and patients elderly, 65 years and more. We should also, we should also improve buildings in the cities, and also thinking about the most the areas of greatest concerns in cities. So not to, let's say, overlook those areas, but always having a clear look at this part of the city as well. And also, and this is happening in some countries in Europe and not everywhere, ensure that both public and private landlords, they can provide safe and healthy accommodations to everyone. They could actually provide energy efficiency as well as R&D to limit energy poverty to the people living in the cities. So those are the three main priorities that we have identified for the officials at the local level. And I believe now Sophie will go to the recommendations for the health sector, right?
Exactly. Thank you very much, Roberta. So that was really like the presentation of the problems and the possible solutions around the healthy buildings. All of what was presented to you so far is in a briefing that HEAL released just last week, and that was already so sent to many policymakers. And for now, what we would like to do in the next a little bit less than half hour is actually to go through questions and answers session with one main question, the question being, what is the role of the health sector now in this very, very important topic for health? So what we would like to propose to you is that we focus a little bit our discussion on the four next topics that I will present to you very briefly, in how we think we should now approach this, and then the floor will be for you, all of you. So the question we are asking ourselves, and that we would like to also ask you, is how can the health sector contribute to raise awareness on this topic? So where are the places where actually those debates could be brought in? And then also, how does the health sector engage in the deliberation of the future European buildings and renovations strategy? As part of the climate efforts, this is directly linked to the European to the Energy Performance of Buildings Directive, so the EPBD. So now that the text is agreed on the EU level, as Roberta told you, now it goes to the member states. And how, and this will be a crucial moment. So how does the health sector engage in those transposition moments? And third question we have is how to share and promote best practices. So you got just a presentation of one, which is the Irish scheme. But maybe there are others, and we would really like to see how we can all collectively share and promote those ones. And yeah, last but not least, and this is often the very first thing to do, is leading by example and by ensuring that all the buildings related to the health sector, so the hospitals, the clinics, or the public health offices, and maybe others we didn't think about. So how do they promote healthy buildings? Okay, so it's now the time for me to really thank you all, and also thank Vijoleta and Roberta for their great presentations. So let's keep in touch. So yeah, so thank you very much, and let's stay in touch with this very brand new topic for some of the people on the fact that buildings are an environment, and this is why we really need to work on them, and we can work on them. Thank you very much. Have a great rest of the day, and talk to you later on this. Bye, everyone.